I'm John Reddick with TurnKey Dental Marketing, and I want to ask you a question. Is your website doctor-centered or patient-centered? You may say that's a strange question, but the fact of the matter is a lot of times when we sit down and we talk with doctors about building out their web presence, a lot of them like to build out websites that look, extremely amazing, with a lot of pictures and stuff, and staff pictures, doctor pictures, and all these different things on there that are aesthetically pleasing to the eye, but they're not patient-centered. You see, when somebody's looking for a new dentist, and no matter what treatment they're looking for, whether it's just general dentistry, maybe they have dental pain, they don't like the color of their teeth, they're looking for better alignment, or maybe they're shopping for crowns, maybe they're looking at dental implants or veneers. It doesn't matter what they're looking for. If your website does not address their concerns, their issues, their questions, their objections, then you're probably going to lose that potential patient. Your website is your online storefront. It's your online billboard to the world. And when people land on your website, it needs to be as least confusing as possible. It needs to have simple navigation. People need to be able to find what they're looking for very, very quickly. Now then, I've been hosting websites, building dental websites, medical websites of all sorts for years and years. And this is what I've found. The majority of people are going to land on your homepage. The second page that people go to, the most trafficked page after the homepage on your website, is the doctor page, the page where people go and look and see who the doctor is, his credentials, and that sort of thing. After that, the interior pages actually start falling off. Very rarely does somebody go and read all the veneers page or a crowns page or those sorts of things. They know pretty much these days that the services and stuff that you're offering, the technology that you have, pretty much every doctor has to some degree. They may vary from office to office a little bit, but all of them have at least digital x-rays. A large number of practices now have pano machines, and they have 3D cone beam. They have CEREC machines and E4D machines for making their own crowns and things like that. And all of that stuff is wonderful. But when people come to your website, they're actually looking to get a problem solved. So the question is does your website address the most common problems and offer solutions, and sometimes more than one solution to those common problems? Many times doctors just want to put pictures of them and their staff and cases they've done all over their website, and that's fine to have those on there. But they need to be strategically organized, and they need to be placed in places that are not going to be so out front that they distract from the content on your website that the person was actually looking for. So when we build out a website for our doctors, we really focus on the messaging. We focus on making sure that your website communicates to the new patient, hey, we understand the problem that you have. We have a solution or solutions to solve that problem. Call us today and let's begin a conversation about making sure you get your problem solved in the most cost-effective and efficient and in the least time-consuming way. So stop and think about it today. Look at your own website and ask yourself, is my website patient-centered or is it doctor-centered? Do I have a lot of distractions on my website? When they land on the home page, is there a lot of moving stuff, and is there a lot of pictures and things like that got me looking in different places, but don't have messaging on there that says, hey, call me and do business with me? Images are important, don't get me wrong. Having good images, before and afters, a smile gallery that they can look at on your website is fine. It's good. People want to see your work to some degree. But at the end of the day, when somebody's got a real bad toothache and they've got an abscess, they don't care about your smile gallery. They want to know how can they get numbed up, made comfortable, and get the tooth out or get the tooth repaired. Even if they have teeth whitening issues or have alignment issues, they don't want to come to your website and find a bunch of distractions. Your website needs to be categorized in a way that potential patients can find what they're looking for very quickly. That's why on a lot of our websites we use a method called I'm Here For. And basically we just spell it out by category. What am I talking about? Let me explain. We'll say something like, I'm here because I have dental pain. I'm here because I'm dissatisfied with the color of my teeth. I'm here because I don't like the alignment of my teeth. I'm here because I have one or more missing teeth. I'm here because I have gum problems. My gums are red. You take them through this process of why they could possibly be there, and then you outline the treatments that can solve those problems and present to them you as the expert to be able to solve the problem for them. But it's better to do that and get rid of the distractions. You don't want people landing on a page about veneers and seeing a whole bunch of stuff about dental implants especially when they don't need them. Keep things minimal. Keep things focused on the problem that's trying to be solved. You'll find, listen, let me just say it to you this way. A confused mind never buys. If somebody winds up on your website and they're confused about where to go, what action to take, what message you're presenting, who you're trying to reach, what audience you're targeting, if they're confused at all, they will not buy. So take away the confusion. Get a patient-centered website, one that focuses in on them. Yes, put your pictures on there, put some before and afters, showcase your staff if you want to and on those things on the About Us and team pages. But on the main pages of your website, make sure they are focused on getting people to the place they are looking for that will solve the problem that caused them to search out a dentist anyway. Again, this is John Reddick with TurnKey Dental Marketing. Thanks for watching, and watch the other videos on this page. You'll be glad you did. And if we can help you, go to turnkeydentalmarketing.com. Our contact information is on there, but particularly an assessment form. If you'll fill that out, we will look at everything for you. It doesn't cost you anything. We'll set up a Zoom call with you and go over things with you in detail. That doesn't cost you anything either. Our job and our goal and desire is to educate you, to help you to understand dental marketing better, how to present your practice better, how to get more new patients and spending less money to do it, but doing it effectively. So give us a call today. Visit our website, turnkeydentalmarketing.com. You'll be glad you did. Thanks for watching. Bye-bye.